Hello, Dr. Vikki Petersen here. I wanted to speak with you today about a condition called eosinophilic esophagitis. I know that's a mouthful, so I think for the rest of the video I'll just say EE, a little bit easier. So your esophagus is the tube that connects your mouth to your stomach, so that's a conduit for food. And eosinophils are a type of white blood cell that gets produced in abundance when there's an allergic type reaction. So if you think of a condition where these white blood cells that get produced in abundance because of an allergic reaction, and they're doing so in a tube that's a conduit for food, what would be the first thing you would think of? Maybe you should change what you're eating. I'm not trying to be rude here, but it kind of makes sense, right? I mean, sometimes it's best not to overthink when maybe the description of the disease kind of leads you to a solution. Yet, the standard treatment for EE, which by the way is found in children and adults, and its incidence has really dramatically increased over the last 20 years, the treatment is drugs. What they do is they give somebody a proton pump inhibitor. That's just a drug that is also given to people with stomach ulcers, and it really diminishes the acid in the stomach. So that's one treatment. And then the other thing that happens to the esophagus in these patients is that it starts to get hardened and actually gets strictures, so it gets narrowed. And so the symptoms are, for children, failure to thrive. Of course, they don't want to eat because it hurts and they feel uncomfortable. And then when they're old enough to speak, they talk about feeling burning or it's hard to swallow. Difficulty swallowing is kind of the hallmark symptom. You find people who chew their food. They have to chew it rather excessively before they swallow. They won't eat certain things like chunks of meat or bread that might get stuck in their throat. So they really have to alter how they're eating based on what they're feeling. So if the drug doesn't work, then they can actually mechanically dilate the esophagus because it's starting to get more narrow. So I don't know if boys and men have naturally narrower esophaguses, esophagi, than women, but for some reason it is more common, the condition is more common in men and boys than it is in women. So there hasn't been much reasoning behind that, but those are the facts. What I wanted to tell you about was a study in gastroenterology that was just published a week ago on February 14th that looked at changing diet. So this was brilliant, right? Because those eosinophils get produced due to an allergic reaction. And it's not that this is the first study showing that maybe you should do something with the diet, but this one had such great results that hopefully it will really impact the community and impact you if you have the problem or if you know of somebody with the problem. And once again, this can start in infants and makes us wonder, with the increased incidence over the past 20 years and with our diets getting worse and worse over the past 20 years, if there isn't some correlation with that. But what this study published in Gastroenterology did, what they found out, they did 3 types of different diets, and they had over 1,300 people that they looked at. And one was what's called an elemental diet. So that is a pure liquid diet that's just amino acids. It's almost like pre-digested food, if you will. And so there's absolutely no possible allergens present in that. So it's a liquid diet. Sometimes it's by a feeding tube if someone is very compromised. But it's just basically, you can imagine, pre-digested food. There's no allergens present at all. And for the people who engaged in that diet, 91% of them saw a reversal of their EE. So the eosinophil number decreased dramatically in their esophagus. The next diet they looked at was a 6-food elimination diet. And so they took the 6 most common food allergies, and that is wheat, dairy products, eggs, soy, both peanuts and tree nuts, because peanuts are a legume, and then shellfish and fish. So those were the nuts and peanuts and fish and legume were each considered 2 categories, not 4. So that was your 6 total. So notice, of course, wheat and dairy were in there. And on that diet, 72% of the patients on that diet improved dramatically and their eosinophil number went down. So that was very significant. And so the takeaway here is that we really want to appreciate the fact that the body does things for a reason. They do it in a location for a reason. The esophagus is the conduit of food from the mouth to the stomach. And once again, these eosinophils are an allergic type of reaction. So doesn't it just make sense to start with diet? I mean, imagine you have an infant who has failure to thrive. I've met very young children who were on these proton pump inhibitors, these drugs, because of EE. The interesting side effect to these drugs is that we know that in order to digest food properly, in order to not create further food sensitivities, is that the stomach has to do its job efficiently with a good abundance of hydrochloric acid in order for that food to be in the properly digested form, so that it then goes into the small intestine, and then the small intestine can do its job of digesting. If you compromise the acid in the stomach, the food is going to be only partially digested. It then enters the small intestine in a partially digested state. The enzymes in the small intestine can't work on it efficiently because it needs to come to it, the small intestine, from the stomach in a certain format, and that's not being properly done because of the decreased acid due to the drug. And now what you've done is you've set up the person for more allergic reactions. So the very nature of putting someone on this drug as the first order of business is possibly, perhaps probably, setting them up for more of a problem with eosinophils than they even have at the moment. So it's not only not getting to the root cause of the problem, as we like to do in root cause medicine, but it might be exacerbating the actual problem. So if you know of anybody who has EE, if they're already on this proton pump inhibitor, you know, it's one thing as an adult if you say, wow, when I'm on this, I'm actually able to swallow. We have to swallow. I'm not arguing that point. We have to eat. But we need to get to the root cause, right? We can't just let this esophagus get stiffer and stiffer and tighter and tighter, and then all that's left is mechanical dilation of it. It's a dangerous situation. So I do hope, if you know somebody, that you'll share this information, and hopefully it can help them out and they can really start to figure out what food or foods are bothering them. So please send me your questions, your comments. I do love to hear from you. And until next time, I wish you very good health.